Hello, welcome to Somerset Place State Historic Site. Today, I will be discussing Maladies and Remedies, Health and Healing in the Somerset Place Enslaved Community. I am situated inside the Plantation Hospital, which is the only known reconstructed hospital in the country, rebuilt here in 2001. The Somerset Plantation Hospital was used to treat members of the former enslaved community, but also used for quarantine purposes when there were infectious diseases at the plantation. Josiah Collins, the plantation's owner's interest in providing a plantation hospital was simply a matter of protecting his investment. Other than land, an enslaved person was considered by a plantation owner to be one of the most valuable property. Josiah Collins could use the enslaved people as collateral on loans. They could also be sold for readily cash or for investment purposes. For example, a former Somerset enslaved woman by the name of Suki Davis was purchased for 60 pounds in 1786, and she had 132 direct descendants by 1865. A plantation was a business, and it was a prudent business practice for a plantation owner to protect the health of the enslaved community. The first known physician on the plantation, Dr. Samuel Dickinson, who was also one of the three business partners in the Lake Company. He traveled to the plantation and he lived in the Cupola House in Edenton. According to the 1785-1790 Lake Company account book, he made monthly trips from Edenton to Lake Phelps to provide medical care to the enslaved community. Detailed information about early medicines and treatment is almost non-existent. He was regularly reimbursed for sundry medicines for Negroes this month, end quote. There were 2 injuries for 80 pounds of oakum and 1 for medicine for old Moll. Between 1785 and 1790, 1,015 gallons of New England rum and 694 gallons of West Indian rum were purchased for use on the plantation. Additionally, between 1839 and 1860, Dr. Hardy Hardison was employed as one of the primary physicians who practiced medicine at Somerset Place for the former enslaved community. He came upon call, and through much of his tenure at Somerset Place, Dr. Hardison and his family resided in a cottage on the Pettigrew's Belgrade Plantation, located 8 miles north from Somerset Place. Dr. Hardison treated the Collins family in their home and was a well-known doctor in the community who also made visits to the neighboring Pettigrew plantations. Dr. Hardison frequently prescribed bleeding and cupping for sick patients, while also administering quinine, calomel, castor oil, among other medicines. Enslaved midwives and nurses like Chloe Drew Bennett, born on May 2, 1794. Chloe was one of the 4 known children born to native African Kitty Drew at Somerset Place. Chloe took care of the enslaved patients when the doctors were not available. Chloe lived in the former enslaved community in a tent 1-room slave home with her extended family of 12 people. Chloe assisted enslaved women in birthing their infants inside of their assigned homes, and if difficult births ensued, Dr. Hardison was responsible for handling them in the hospital. Although there were likely others, Chloe Drew Bennett is the only documented enslaved midwife at Somerset Place. Annette Horton Baum also practiced midwifery. Plantation records indicate she was a washerwoman. It is reinforced by her birth certificate on which she is listed as a midwife. She died in 1923 at 90 years old. It is recorded that Dr. Hardison set broken bones and combated disease epidemics in the Plantation Hospital, like influenza, cholera, whooping cough, measles with pneumonia, scarlet fever, and dysentery outbreaks, also malaria. Since Josiah Collins III provided medicine and equipment for doctors, Hardy Hardison charged a standard $3.50 for each visit to Somerset Place. Josiah Collins usually paid him at the end of each year. One of Dr. Hardison's account books has survived, although it provides scant details about what he did during his visits to the plantation. Although members of the Collins family were prolific writers, their letters did not include information about the day-to-day health issues experienced within the enslaved community. The only narrative source of information about the health in the hospital at Somerset are letters written by the Collins' nearest neighbors, the Pettigrews, who owned 3 smaller plantations near Somerset Place. Other enslaved caregivers included Penny Gossam, who also served as a house servant who took care of Charlotte Cabarrus while she was dying. Charlotte was a free black nanny for the Collins' 6 sons who worked and lived at Somerset Place for 30 years. Charles Lockhart Pettigrew wrote a letter to Jane Caroline North Pettigrew on November the 28th, 1860 from Magnolia and Bernarva plantations. And I quote, "Before day, I heard a great knocking at my door. It proved to be Penny Gossam, who has been the attendant and nurse of Charlotte Cabarrus since she had been sick. She said that she had bought morphine and scales for Aunt Charlotte, had told her to ask me to weigh some out for her. She was suffering much, and she did not trust anyone but a white person to do it for her. So I got into bed, for I was exceedingly cold, and told the girl to bring me the small vials, and I would proceed to weigh the morphine in bed. About 10 o'clock, the doctor came. I then told him how much morphine I had given Charlotte. It was a large quantity, and he said, well, notwithstanding she had 10 called within the past 17 hours, about 6 o'clock, Mr. Patterson said it's not a bad sign for Charlotte to have hiccups so much. I replied, very. A sick person very sick rarely recovers has them. At 1/2 after 2 in the afternoon on Monday, she breathed her last. Other narratives indicate the following. Jane Caroline Pettigrew to Jane North, January 21st, 1858, Bernarva Plantation. I quote, the measles are breaking out fast and furiously on the plantation. Men of 35 are taking them, and several children. So far, the cases have been mild. I hope may continue so. Mr. Collins has lost several of his people lately. 2 or 3 of them were certainly measles driven by cold, end quote. Another quote, Charles Lockhart Pettigrew to Wim Shepherd Pettigrew, February the 4th, 1858, Scuppernong. I quote, a few days before Christmas, Mr. Collins loaded a vessel with grain, and after the vessel left, it was reported that a man was sick on board. About Christmas, 3 of his men broke out with bumps of some description. It was reported by Mr. Agnew that it was smallpox. The doctor said it was a sort of whale itch. No attention was paid to it, and they were very well. In a few days, there were 60 or 80 cases, and the doctor then said it was measles. Vaccinations to prevent contagious diseases were used. Medical instruments like this vaccination lancet were used to perform smallpox vaccinations, which was developed in the late 18th century. Smallpox vaccines were usually administered in the pus-filled sac of an affected person, and the nurses would then insert the lancet into the unaffected person. Another entry indicates, I quote, Mr. Collins has a hospital full of sick. His grown people have dreadful dysentery. A few days since, a woman died. Last night, a man died, and there are several more extremely ill with it. Charles Lockhart Pettigrew to Jane Caroline Pettigrew, September 11, 1860, at Somerset Place. The infant and child mortality rate here was very high within the former enslaved community due to stillbirths and childhood diseases. Additional notices were taken on the following. William Christian Warren to Ebenezer Pettigrew, August 7, 1831. I quote, I am now at Mr. Collins attending a boy with that terrible disease, tetanus. He had his leg severely lacerated 10 days ago, and lockjaw has supervened. I have little hope of his recovery, though it is not at its worst stage yet, end quote. Dr. Hardy Hardison to Wim Shepherd Pettigrew, February 11, 1858, Scuppernong. I quote, I suppose you heard of the measles being on the lake. It commenced at Mr. Collins about the 1st of January. It's a rather mild form of disease. About 124 have it at Mr. Collins's. 2 had died with complications of measles with pneumonia, end quote. Jane Caroline North Pettigrew to Charles Lockhart Pettigrew, March 8, 1859, Bernarva Plantation. I quote, some scarlet fever cases terminating on a sudden so fatally makes one very watchful. A child of 2 or 3 years old died at Mr. C's last night, who had been playing about all day, was taken sick at night, dead early the next day. Charles Lockhart Pettigrew to Jane Caroline North Pettigrew, August 19, 1860, Somerset Place. I quote, I heard Mr. Collins tell Mr. Patterson that he had to bury 1 week 6 children. Mr. Collins said to me he had lost 16 Negro children. They died principally by whooping cough. Dr. Hardy Hardison to Wim Shepherd Pettigrew, September 18, 1860, Scuppernong. I quote, Mr. Collins' young Negroes suffered terribly with whooping cough. Quite a number of them died, end quote. Accidents at Somerset Place also took the lives or permanently injured some enslaved people. Lumber was a major crop at Somerset Place, and with the operation of a lumber mill, injuries were frequent in addition to agricultural work being performed. A list of Negroes belonging to the estate of late Josiah Collins, deceased at Lake Phelps, were valued by commissioners March 18, 1840, and it had 67 males listed. They were listed as having disabled shoulders, rheumatic conditions, leg infirm for 10 years, broken bones, hands injured, also including lame and hip. Splints and fracture boxes, very similar to the ones you see here, were used to stabilize and set broken bones. A listing splint, similar to this one, was used to stabilize a patient's body and to immobilize him or her for transport. Also, fracture boxes, similar to the one you see here, were used to set tibia and fibula fractures, and the patient was bedridden for long periods of time. A Scottish surgeon, Robert Liston, invented his namesake splint, and this device remained in use into the 20th century. Other medical instruments, such as the axilla thermometer, was used to clinically take temperature in the underarm of a patient with mercury inside that reacted to the temperature within 20 minutes. Bloodletting was common practice here, and a scaraficary, similar to the one you see here, was used. Tooth extractions took place in the hospital, and tooth pliers and tooth keys like these were also utilized. The doctors also used screw tourniquets, similar to the one we have here. A tourniquet very similar to this one would have been used to restrict blood flow in the legs in order to perform amputation surgeries. A French surgeon named Jean V. Petit invented this device in the late 1700s, and it remained in use throughout most of the 19th century. The screw tourniquet would have been used during an amputation surgery of Rebecca Drew to restrict the blood flow in her leg arteries while performing an amputation surgery of her feet, using an amputation saw to cut through the bone in her leg. Becky Drew had been born in Edenton in another plantation, had been sent to Somerset Place at a very young age of 15 to work in the fields. She was homesick for her mother and family. Becky was caught trying to run away and placed in the stocks overnight. Unfortunately, the night turned bitter cold, her feet became frozen, and she lost circulation in both legs. Her feet had to be amputated right here in this hospital that was situated here. Despite her handicap, Becky could still walk and was able to do small jobs. Josiah Collins III was away from Somerset Place when the overseer took it upon himself to mete out Rebecca's punishment, and according to his family tradition, was deeply disturbed with the outcome. The Plantation Hospital was used by the former enslaved community as a last means for health care. Most enslaved people relied on natural remedies like roots and herbs and plants to cure ailments. Hosabaker, sassafras, wintergreen, and some dry root mix, and made tea to drink for colds. According to oral testimonies, tansy and mullein, also called rabbit tobacco, were used. According to an oral testimony by Susan Price, she was 101 years old in 1990, interviewed by former Somerset site manager Dorothy Refford. I quote, said, "I used to use tansy and mullein for sickness. Tansy, make a tea out of it when you feel bad inside. Mullins grow around the fence like. Tansy was greens too. You boil it, but don't cook that vinegar and salt in it. You put it in after it's made and put it in a jar. Put a cup of vinegar and a cup of salt, about 5 gallons of water. Put your feet in that water and wash up and down wherever it hurts." Other remedies included the use of cobwebs packed in a wound or deep in a cut to cease bleeding. Pork fatback meat, bandaged on deep cuts to promote healing the skin to prevent scar tissues or keloids from forming. And to rid a cold, pine tops and some rabbit tobacco will be boiled into a tea to drink. The former enslaved community were rationing out 3.5 pounds of salted meat per hand per week, meal, flour, rice, and molasses. They supplement their diets with fish from the lake and also growing freshly grown vegetables in their garden patches behind their homes, to include turnips, greens, sweet potatoes, okra, red peppers, potatoes, and pumpkins to remain healthy as possible. Thank you for joining us. To learn more about Somerset Place State Historic Site, visit our site for a guided tour. We're open all year, Tuesday through Saturday from 9 a.m. to 5 p.m. We're located at 2572 Lakeshore Road, right here in Craftsville, North Carolina. Again, thanks for joining us.